Hi, everybody. It's Dina, and coming to you live from our office. This is my partner, Anthony. Anthony and I have a passion and love for holistic medicine, and Anthony's also a nurse. So meeting him kind of filled in some gaps for me about my own health, and I just thought he has so much information that I wanted him to share with the group, with you all, with this newsletter, and add more value to my monthly reach outs to you. So with all of that, I think Anthony can let you know about himself better in some ways than I can. So today's topic is going to be about basically introduction to health. So Anthony?
All right, thank you, Dina. So, yes, I'm Anthony Mosora. I have a background as a registered nurse and certified health coach. I've been working in a variety of roles in the conventional medical system now for over 13 years. And for about half that time, I've also worked in the holistic arena. So I've been on the front lines of both. So I bring a unique perspective to the table. I started back in 2008, pretty much fresh out of high school. Started out working in a position that was pretty much equivalent to a nurse assistant. I did that for 6.5 years, so I really worked with patients with their activities of daily living, checked their vital signs, just helped them take care of their basic needs. During part of that time, I worked as a house orderly, so I got to respond to emergent situations, performing chest compressions on patients experiencing cardiac arrest, for example. And then I became an LPN, which is like a licensed practical nurse. Did that for a little bit, and now for coming up on 6.5 years, I've worked as a bachelor's prepared registered nurse. It really goes back, though, to my early childhood. I was taught about the importance of addressing the body, the mind, and the spirit, and the associated categories that come along with that. And that's really the way we need to do it. That's the way we need to approach it, not only for ourselves, but for others. If we're trying to help them achieve optimal health, we need to be considering these different categories of health. So with all that being said, I started working on the front lines. Early on, I knew from my own clinical experience, as well as what the data was showing in the literature, that most of the suffering, because I saw a lot of suffering, saw a lot of death, especially working in conventional medicine, and I knew that most of it was actually preventable. So there's a lot of unnecessary suffering going on. And unfortunately, although conventional medicine has a lot of benefits, which I can talk about, there's a time for conventional medicine. But one of the problems is you'd have people come in with all of these different chronic health conditions, but they were getting managed, okay, instead of focusing on the root cause, instead of focusing on the actual lifestyle factors that resulted in these chronic conditions and all this suffering. So I was seeing a lot of these sick patients. They'd come in, we'd put out the fires, we would manage them, stabilize them, discharge them, and oftentimes they'd come right back in. So it was like a revolving door. So I knew from early on, just something wasn't right. We could do more than that. Well, thankfully, a number of years ago, I was introduced to a number of some of the top holistic physicians in the world, especially when it comes to medical nutrition. In fact, one of the gentlemen, I actually just talked with him yesterday, his postdoctoral thesis is in the Smithsonian as a national treasure. And it's the book on medical nutrition. It's really what helped pave the way to our understanding of things such as nutrient deficiencies and how that is a major contributor to the problems we're dealing with today. The chronic challenges we see so many people suffering with, especially in the Western world and the United States. So all that being said, when I really started diving in, it became just a committed, avid learner of the holistic approach. And it's been amazing over the last few years to see the sort of testimonials I've seen, to look into the evidence, to look into the literature, and see how day-to-day things that we can do, you and I can do, and Dina can do, which don't require a prescription or a consultation with a surgeon. There are things we can do in our day-to-day lives to optimize our health, to get to the root of health challenges, and to live a more robust, healthy, just better quality of life, quite frankly, just having that available. So when you've seen the sort of things I've seen, and you see the sort of issues dealt with through holistic medicine, and then seeing the suffering that's going on in conventional medicine, it really has put in me just this great zeal to share the good news of the holistic approach. But that being said, you have these two main approaches. Conventional medicine, what is that good for? So God forbid you have a horrible trauma take place. You're walking down the road and you get hit by a bus and you get a triple compound fracture of your femur, okay, and now you're bleeding and it's an emergent situation, right? Conventional medicine is great for that. Trauma care, emergency medicine in certain cases, surgery if it's actually needed, a handful of infectious diseases, the sort of things we can do. I've seen it firsthand. People come into the hospital, their blood pressure is tanking due to, let's say, sepsis related to pneumonia, which got out of control. We can give them some, normal saline, some IV solutions, some heavy-duty antibiotics, and we can help save their lives. Antibiotics are overused and unfortunately lean on that too much. But the point is, conventional medicine does have its place. I don't want to discredit them because they do have value to provide. That being said, unfortunately, we live in a culture where it's pretty much conventional medicine all the time. And like I said, there's all these people going to their providers and it's conventional medicine and the focus is drugs and surgery. Manage your condition. Let's manage your condition, and there is not nearly the sort of emphasis needed on getting to the root cause of the problems, be it physical, spiritual, whatever, and prevention. That's the other thing,
What brings health in the body as far as food and like Anthony said, nutrients and minerals, and this is kind of what